My name is Meg Schwarzman. I'm a physician and also an environmental health scientist. I do some clinical work, and mainly I teach and do research at UC Berkeley. And I'm mom to Oliver, who just turned 1. It was February 2nd, 2016, and I was riding my bike home from work the way I normally would. What I've learned happened is that I was run over from behind by a driver who was under the influence, and he actually didn't even know he'd hit me and dragged me about 60 feet under the car, and I was pinned under the car, and I didn't know what happened. I never saw it coming. I had a lacerated liver and was basically bleeding to death from that.
That first night it was a little tenuous. I actually met her the next day when, because of her liver injury, she needed several operations.
I woke up 5 days later in the ICU. Because I wasn't aware of the accident, since I wasn't awake, I think I didn't know for sure that Oliver wasn't with me. The hardest part for me was when I first woke up, not knowing if Oliver was okay.
Meg was nursing our son when she was injured, and I knew it would be important for her to do everything that they could so that she could nurse Oliver when she got out of the hospital.
Meg was unconscious and intubated when I first met her. That's a bit unusual for lactation consultants. Along with the ICU nurse who was taking care of Meg, we developed a plan to continue to use the breast pump as close to every 3 hours as possible, which would mimic what her breasts were used to doing when she was at home with her infant. I have to give props to the ICU nurses who took the teaching but continued it, every 3 hours, 24 hours a day while Meg was under their care.
It was one of the things that, among many others actually, that really impressed me about how the ICU staff they look at what's needed. Everyone is an individual. That's what was clear, and they could see this is a nursing mom. Let's figure out what we can do here. I think most people don't appreciate what a trauma center is and what it takes to keep a functioning trauma center going. It's not about services rendered in an emergency room. It's about 24-hour surgery when you need it, with all of the expertise that is needed. Without those services, Meg would not have survived.
It took so many people, both to save my life in the first place and then help me get through those first couple weeks that were so difficult. From not being able to breathe to managing my pain. It really took the whole team, and I'm so grateful.
Megan's case really exemplifies what the new ICU will do for patients like Megan and also their families. We are really excited about the opening of the new acute tower and the modernization that it will bring. Our ability to care for that patient on a patient-centered approach and to provide the support for the families will be a wonderful thing in the new ICU.